Mumps is an acute viral infection characterized by fever and inflammation of the parotid and salivary glands, and on occasion the sublingual or submaxillary glands. It has a 2 to 3 week incubation period. Mumps is transmitted through respiratory secretions from a person infected with the condition. It can be spread through the air via infected droplets, as well as through direct contact with contaminated saliva. Signs and symptoms of mumps includes parotitis, anorexia, headache, low-grade fever, malaise, vomiting, pain with chewing, pain with swallowing, and nuchal rigidity in the posterior neck. Within 24 hours of the onset of symptoms, the parotid glands swell and becomes tender to palpation. It is not uncommon to see unilateral swelling. Children between the age of 5 and 15 years old are most commonly affected, but older adults can get it as well. Mumps can be diagnosed based on symptoms alone. The physician can also look at the position of the tonsils to see if they have been pushed to the side. If the patient has an atypical presentation, a blood, urine, or saliva test may be performed. Cerebral spinal fluid test may be performed in extreme cases. There is no antiviral medication for mumps. Current treatment helps to relieve the symptoms until the infection has run its course and the body builds an immunity. Most people will recover in 2 weeks. Some things a patient can do to help relieve the symptoms are to consume plenty of fluids, preferably water, and to avoid fruit juices. They can also put something cold on the swollen area to alleviate the pain, eat mushy food or liquid food, since chewing will increase pain, getting sufficient rest, gargling warm salt water, and taking pain medications such as acetaminophen or ibuprofen. The best prevention for mumps is to be vaccinated, which can be done either alone or in the MMR vaccine. It can be given to an infant just over 1 year old, and again as a booster before they start school. An adult can be given the vaccine at any age. 50% of patients experience CNS involvement, but only 1 to 10% manifest symptoms. Death is mostly attributed to CNS involvement and occurs in 1 to 3 deaths per 10,000 cases. The vaccine is used in 23 of 25 developed countries and 40 of 168 developing countries. My infectious disease was mumps, and here are my references.